Welcome everyone to the first ever VIA podcast. Today, our discussion will be all around Marburg disease. We are lucky to have Dr. Gary Harstein with us. Dr. Gary is an anesthesiologist and emergency medicine physician specialized in disaster medicine. He is the Chief Medical Officer of VIA Medica. Welcome, Dr. Gary. Can you tell us more about the Marburg disease and how is it transmitted?
Marburg disease is one of the, what we call viral hemorrhagic fevers. It's not very well known in the world of in the normal world. But of course, if we talk about Ebola, everybody knows about Ebola. They are both viral diseases. The virus that causes them are cousins, and clinically they're much the same. These are kind of nightmare diseases. They're very severe. There are very few treatment options. And these are the kind of things that you really, really don't want to get. Marburg itself is the name of a German city. And this was the city in which the virus was first diagnosed in a patient with what became known as Marburg disease. The Marburg virus lives in a certain species of bat. These bats live in certain African countries, and the virus does just fine inside these bats. The bats don't mind at all. They don't get sick at all. But sometimes the virus can jump to other species, or it can be transmitted from these other species, which are what we call intermediate vectors, or in people who are exploring caves where these bats live, these people can be exposed to bat saliva, bat excretions. They can be in proximity to these bats, and the virus can then jump from the bats to human beings, where it makes them incredibly sick. Once it is present in a human being, there is then human-to-human transmission, and that transmission can occur through any of a number of routes: contact from skin to skin, contact with secretions, aerosols, bed sheets, surfaces that become contaminated by the ill person. So once it has jumped to a human being, the entourage or the care team of that human being are all at very high risk without precautions of themselves becoming ill.
And Dr. Gary, what are the symptoms and treatment?
When you get sick with Marburg, there's an incubation period during which the virus multiplies inside the person, and then it usually presents in a kind of non-specific but very severe way. Presentation is usually onset of high fever, severe headache, severe muscle and joint pains, followed by abdominal pain, chest pain, nausea, vomiting, and diarrhea. This is then followed by the onset of shock, where the blood pressure goes down, liver failure, and notably the blood coagulation system fails, which leads to bleeding, kind of generalized bleeding from the mouth, from the nose, from all the bodily orifices. I hate to be explicit. And this bleeding and shock state in somewhere between 1/3 and 80% of cases actually leads to the patient dying. The bleeding is why it's called a hemorrhagic fever.
Is this disease present in the MENA region?
As far as I know, the outbreaks of this disease mainly occur in the African areas where these bats live. So I believe there is or just was recently an outbreak in Uganda. Why? Because these bats live in Uganda. The only cases that we would have in the MENA region would be cases that are imported by people who have traveled to these areas and become infected and travel during their incubation phase, and then they get sick once they're here. Alternately, these would be patients who are medevaced from Africa to this area. As far as I know, there are currently no cases in the Middle East.
Okay, that's great to know. How about for those who actually travel abroad? Is there a way for us to prevent transmission and stay safe?
Great question. There is currently no accepted, validated, publicly available vaccine for Marburg virus. There is a vaccine that is just emerging from experimental to public use for the very closely related Ebola virus, but we're not there yet with Marburg. if you're going to an area where these bats are endemic, and I highly suggest that if you're traveling to Africa, you really delve into the travel medicine part of your voyage, whether it's for pleasure or business, go to the CDC, go to the NHS, read extensively about where you're going. If you're going to an area where this virus is endemic, you need to take certain precautions, especially if you're going to be exploring caves, if you're going to be in the jungle regions where these bats are frequently sighted, then you're going to need to take precautions to not be exposed to various bat excretions, secretions, not be exposed directly to bats.
Thank you, Dr. Gary, for all the valuable tips. That's all that we have for you today. Thank you for listening in to the first ever VIA podcast. Have a great day, everyone.